20-year-old Silongezi Mdimba from Binga is hopeful that her child, who has been due for a surgery but was too underweight to be operated on, will soon gain enough weight. At 9 months, weighing only 5 kilograms, she has spent almost 4 months in hospital with the child's condition fluctuating.
Hayi abamfaka ngalutho mfaka amalembu. Ngiyavala lamalembu. Ngaphumela ngikhipha bakhipha ithumbu phandle. Kuthi abayamlungisa kade sokala weight. Boswayenziwa last year bathu ubuye mhla wa-9 May ngabuya 9 May bathi akala weight so akuyenza ukuthi simu-operate.
She represents the plight of many young mothers who are not gainfully employed and worst affected by the drought. Due to economic hardships, some mothers are forced to wean their children much earlier. Speaking during a United Nations International Children's Emergency Fund media tour of Mpilo Central Hospital, Matron Penny Ncube said young mothers were struggling.
The current situation, we may not be having as many patients, but the cases are rising as compared to the previous numbers that we had, because before we were having numbers maybe 6 and below, but now we're gradually going up as we're now having 9 patients.
She said some of the children were from as far as Binga and Cholocho districts, which have been seriously affected by the drought. Matron Ncube said UNICEF was providing supplements for the children as well as technical support to nurses.
We get assistance from the UNICEF. UNICEF helps us in the training of the nurses in the management of acute malnutrition. These are the nurses that we then allocate to nutrition unit, where they are going to implement the knowledge that they have received, thereby feeding patients. And they also help us by supplying us with the commodities such as the therapeutic feeds, which is ready to use therapeutic food, the plumpy nut, which we give to children. They also give us F75 and F75, which we also administer to children.
UNICEF nutritionist Mr. Vengai Taremba said his organization was working with the government to address issues of malnutrition.
So it means then there is a problem in terms of our food security situation in the urban areas. And even in terms of malnutrition across the country in the urban areas, there's been an increase in acute malnutrition to around 5.6% in urban areas from that ZIMLAC survey. And this is quite alarming, because we need to have, we don't have to go beyond 5%. It actually has to be below 5%. So if it's around 5% and above, it means it's alarming for, for global acute malnutrition.
He said there was a need to educate women on the importance of breastfeeding to avoid malnutrition.
Acute malnutrition prevention, as well as prevention of chronic malnutrition. So in the care groups, we have also the integration with other potential causes of malnutrition.
These affected mothers and their children represent more than what meets the eye. It's a big challenge that should force all stakeholders to bring resources together. This could just be the beginning. For ZTN Prime, I'm Andile Chuma in Bulawayo.
Konapo, ipapo pa ZTN Prime, DSTV channel 294, the place to be.